Hi, I'm Alicia Koné. I am the owner and president of Koné Consulting.
Bonjour, je m'appelle Sekou Koné, je suis vice-président des affaires internationales à Koné Consulting.
Sekou and I are still really hoping to take a group of Americans on a tour of Côte d'Ivoire in 2021 when the world is a more certain place. But until then, we wanted to bring you some news about what Côte d'Ivoire is doing to flatten the curve in that country.
So as of today, there are about 950 cases of COVID-19 in Côte d'Ivoire. 310 people have recovered from the disease, but unfortunately, we have 14 deaths.
In Côte d'Ivoire, they're taking similar measures as we are in the US to try and flatten the curve. They have instituted nightly curfews and they're asking people to stay home if they don't have essential business to conduct. They have closed all non-essential businesses, and even some essential businesses like the public markets have restricted hours, right?
Yeah, the public market have restricted hours now. So you know that in Côte d'Ivoire, people go to the market like every day, open market every day from 6 to 4, 5, 7 for some people. But because of coronavirus now, COVID-19, they have shortened the time to 2. So people are required to leave the market by 2 p.m. so the market can be disinfected.
Okay. They're also encouraging citizens to wear masks when they're in public. And one of the things I'm finding really interesting is they are installing hand washing stations all over the country.
So government organizations and NGOs and some private companies are donating hygiene kits, including plastic bucket and soap to communities. So public hand washing station can be made available in markets and other gathering places.
Yeah. It's a great idea. Another thing that I've really been interested in is that the government has been able to mobilize community health workers that were already trained to help prevent the spread of Ebola and dengue fever and other tropical illnesses that are present in Côte d'Ivoire all the time.
Yeah, so in the US, we can learn from West African countries on how to respond to an epidemic.
Yeah, absolutely. I actually read an article today online in a journal called Stat, written by 2 researchers who did research on the Ebola epidemic. And they said that, they think Western countries have 5 things that we can learn from West Africa about controlling epidemics. And providing public hygiene facilities is one of the 5 ideas that they suggest.
So here in this country, we could put hand washing station at the entrance of every stores.
Yeah.
That could help cut down on the spreading of the disease.
Absolutely. I think that's a great idea. In the Pacific Northwest, I'm only aware of that happening in one place. I believe they still have a hand washing station at the Commissariat Joint Fort Lewis McChord base in the Tacoma area. And I heard they even have an MP timing people when they wash their hands to make sure they're doing it for 20 seconds. When we compare the practices in Côte d'Ivoire and then look at the available data today that we can compare, in the United States, as of April 22nd, we were experiencing a rate of about 136 confirmed COVID-19 deaths per million people. Compare that to Côte d'Ivoire as of the 22nd, it was less than 1 person, so 0.49 people per 1 million residents. So, in the US, we're being much more impacted by this than in Côte d'Ivoire.
Happy Ramadan to everybody in Côte d'Ivoire. Just remember, when you go in public, wear your mask. Don't forget. Just like that.
I want to thank all the public health care workers in the world, including my own husband. Thank you, Nurse Sekou.
Thank you very much.
And if you're interested in ordering your own mask, we're making these and donating 20% of the proceeds to our partners in CI, Well NGO, and the St. Genevieve Welcome Center in Catiola. Go to our website for more information.